Do you get outer knee pain from IT band syndrome? IT band syndrome is one of the most common causes of outer knee pain, especially in active people. And if you're an active person and you have knee pain, it can really cramp your lifestyle because people who are active like to stay active. In fact, aerobic activity can be physically addictive. Some of the endorphins that get released when you're active for long periods are chemically similar to opioids. That's what's known as the runner's high. And so when you can't do the activities that you enjoy, you can become almost depressed. And so how do you get back to the activities you enjoy, whether it be running or walking or cycling or rowing or whatever your activity of choice? How do you get back to it as quickly as possible if you have knee pain from IT band syndrome? Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what causes IT band syndrome and how to get rid of it as quickly as possible, plus 7 different stretches and exercises that you can use to help get rid of your IT band syndrome. So first of all, what causes IT band syndrome? Well, your IT band or iliotibial band runs from your hip or ilium down to your tibia or your lower leg bone, hence iliotibial band. Now, they used to think that IT band syndrome was caused by the repetitive bending and straightening of your knee, where the IT band was thought to roll over the front of your knee as you straighten and come back behind it as you bend. And so they thought it was a friction syndrome. But studies in 2006 and 2007 out of the University of Wales showed that it's actually really attached to your thigh bone or your femur. It doesn't move back and forth. And even though you can kind of feel something move, it's really just tensioning of different parts of the fibers of the IT band, the front fibers or the back fibers. And so the IT band syndrome isn't really a friction syndrome of that IT band moving back and forth, but rather it's a compression syndrome of your IT band getting stretched this way and compressing on the fat pad that lies between your IT band and your thigh bone or your femur. And so how do you stretch your IT band if it's tight? Well, you don't. Your IT band is, for all intents and purposes, a tendon. It's really just a thickening of the fascia in your leg, but it functions like a tendon. And a tendon's purpose is to transfer forces from a muscle to a bone. So it just happens to be a really long tendon. Now, you don't want a tendon to stretch because, again, it's supposed to transfer force. It's not supposed to stretch and lengthen like a muscle. Furthermore, the IT band's made of really, really thick collagen fibers. So it would take incredible amounts of force to be able to stretch it. And even if you could, you don't want to. So what do you do if you do have IT band syndrome to get back to your activities as quickly as possible without injuring it further? Well, one of the most common things that people do for IT band syndrome is foam rolling. So the first exercise is to take the foam roller and throw it across the room because you don't need it. Again, you don't want to stretch or lengthen your IT band because it's a tendon. So don't think about length, think about strength. And in most cases, IT band syndrome is caused by adduction of your femur or your knee going inwards with respect to your hip. If you remember back from geometry, the shortest distance between 2 points is a straight line, and the shortest distance between 2 lines is the perpendicular to those 2 lines. So if your 2 lines are the ground and your pelvis, the shortest distance is the perpendicular between your pelvis and the floor, which is the line that your leg should follow along as you're walking or running. But if your leg's going in that way, you're taking that fixed length tendon, basically, and trying to stretch it over a longer length. So you don't actually need to lengthen the tendon, you need to shorten the distance that you're trying to move it. And a lot of times that happens because of weakness in your glutes or your hip muscles. Your tensor fascia lata is one muscle that's attached to the IT band, but the primary muscles that you should be using to help balance you on one leg as you're walking or land on one leg as you're running are your gluteus medius and your gluteus minimus on the side of your hips. And so if you want to avoid overstretching your IT band farther than it's supposed to go, it makes sense to strengthen those muscles. Now, let's start from the baby steps, starting with step 1. So if you can't even balance on one leg, say you're having difficulty walking and getting outer knee pain when you walk, then just balancing on one leg without allowing your knee to go in this way, or also without allowing your pelvis to drop. Those are really both the same motion of hip adduction, whether you're doing it this way or whether you're doing it this way. So standing with your pelvis level to the floor, again, you want the perpendicular between the floor and your pelvis. So you want your pelvis to be parallel with the floor. If you need to, hold on at first and then work on gradually letting up until you can balance on one leg. You have to be able to stand before you can walk, and you have to be able to walk before you can run. So start from baby steps and just start practicing by balancing on one leg. Now, when you can do that, the next step is to start bending your knee. And so you can bend like that. And you don't need huge amounts of knee bending, because even when you're running, the amount of knee bend is only a few degrees. It's not even that 30 degrees in most cases that was thought to implicate the IT band. So you really just need to be able to bend through a few degrees of motion. But when you're doing that bending, you don't want to allow, again, adduction or adduction of your hip. And so start out standing with your pelvis level and then practicing doing little mini squats to see it from the side. Just little mini motions like that. Now, once you've been able to stand on one leg and then do little mini knee bends on one leg, the next step is to get back to running, if that's your goal. And when you run, you have an impact force. You have a ground reaction force when you land. Now, ultimately, when you are running, if you can shorten your stride a little bit and take shorter, quicker steps rather than long bounding steps, you're going to decrease how much ground reaction force that you have, and thus decrease how strong your hip muscles need to be. But ultimately, you will have to deal with some ground reaction force when you land from each step. And you'll have to do that over and over and over, approximately 1,000 times per mile. So you really need to get those muscles strong. And if you're just starting to get back into running, then starting out doing little mini sequential hops where you're standing on one leg, stick the landing, jump, stick the landing, jump, stick the landing. And again, you're trying to think about not letting your knee cave inwards. You also don't want to double hop. So you want to be able to get a nice solid land, absorb shock with your thighs and with your glutes, and then go on to your next jump. So again, stand on one leg, jump, 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 go back the other direction, jump, 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 jump. Start out with shorter jumps, and as you get good at controlling your landing, then you can progress to longer and longer jumps. So those are the strengthening exercises. Again, standing and balancing on one leg, mini squats on one leg, and then the jumps landing on one leg. Now, what about stretching? There's got to be some stretches I can do, right? Strengthening takes a long time. It takes a minimum of 6 to 8 weeks to actually build muscle, but stretches can work fairly quickly. And sometimes there are some stretches that you can do for outer knee pain that work pretty well. Now, this one doesn't work for everyone, but when it does work, it works pretty well. So when you go into that adduction internal rotation position with your hip, it can create a joint dysfunction at your knee, where the femur rotates inwards, the tibia rotates outwards, and they can also have sort of a gliding with respect to one another. So if you do the opposite of that motion, you externally rotate your hip, and then you think about pushing with this hand on the inside of your knee and pulling with this hand on the top of your shin or on the top of your tibia. That helps reset the joint alignment. And again, this doesn't work for everyone, but if you do have a joint dysfunction, you may just notice that you get a pretty rapid improvement in your knee pain. And so do this for about a minute or so, and then reassess and see how you feel. So that's the first stretching exercise. Now, another stretching exercise that people don't typically think about with their IT band is actually stretching your calves. And the reason for that is that if you don't have good flexibility in your calves, when you go to take a step, whether you're walking or whether you're running, your body has to find some way around getting over top of your foot. And if you don't have the flexibility in your calves to get straight over top of the foot, your body can get around that by doing a motion known as pronation. But pronation causes your knee to come inwards, and it causes that same adduction movement at your hip that can cause that IT band to become taut and compress on the fat pad that's underneath of it. And so if you do have stiff calves or lack of mobility in your ankle, you can end up getting an increase in outer knee pain. And so to stretch your calves, one easy way to do that is standing facing towards a wall. Put your arms up on the wall, feet pointed towards the wall, and then stretch into it, keeping your heel on the floor. You don't want to allow your heel to come up like that. You've got to make sure to keep your heel flat on the floor, and then stretch in until you feel a stretch in your calves, and hold for 60 seconds to 90 seconds. Now, another common mistake that people make when stretching their calves is that they allow that pronation motion to happen when they're stretching. And if you allow that to happen when you're stretching, you can bet you're probably going to allow that to happen when you're walking and when you're running as well. So make sure that you don't allow your foot to turn out and stretch your calves like that, which I'd say a good majority of people do that. So make sure you keep your toes pointed straight ahead. You want to try to keep a little dome in your arch, so keep your arch lifted a little bit. And stretch forwards like that. Again, keeping your heel flat on the floor. Again, hold for 60 to 90 seconds. Now, while you're up against the wall, there is another exercise that you can do that's good, especially for runners, because it helps strengthen your glutes and your calves, both of which you need to go to push off to the next step. But you also use those muscles to a lesser extent when walking. So it's good for people who have IT band pain from walking as well. So as you're doing your calf stretch, you're leaning up against the wall. Now if you just change your hand position a little bit, put your hands up a little bit higher on the wall, and then think about coming up on your toes. So now you're firing your glutes here by pressing into the wall, firing your calf muscles, and you're also flexing your hip. So if you picture a runner kind of in mid-running motion, where they're running and running, it's that same sort of position. So again, face towards the wall, come up on your toes, squeeze your glutes, and lift the knee high. Then alternate legs, lift the leg, up on your toes, squeeze your glutes, and hold for about 10 seconds each leg. And if you do that 10 times on each leg, it does get surprisingly pretty tiring. So that's the sixth exercise. Now, what about the tensor fascia lata? That's the one that people always talk about with IT band syndrome. And again, think about strength before length, but stretching your tensor fascia lata can be helpful if you do have IT band syndrome. Additionally, the stretch to stretch your tensor fascia lata also stretches your quadriceps, which is pretty good for most people with knee pain anyway. So the way that you would do that is a kneeling hip flexor stretch, which stretches your rectus femoris, as well as your tensor fascia lata and your iliopsoas, which attach to your lower back. So go in a half kneeling position like this, push your pelvis forwards. You don't want to allow your lower back to arch, and you'll be able to stretch a lot farther if you let your lower back arch. But think about tucking your pelvis underneath of you, and then just pushing your hips forwards until you feel a slight stretch on the front of your thigh. Now, if you do want to target the tensor fascia lata a little bit more. It does sit slightly on the outer side of your pelvis, so you may have to kind of push this hip out to the side just a little bit. And you have to play with the angles, but kind of pushing that hip out to the side when you're doing the hip flexor stretch can help target the tensor fasciae lata a little bit more. But again, if you do have IT band syndrome, think about the strengthening exercises first and then the stretching exercises secondarily. You can check to see if you have a knee joint dysfunction, and if you do, doing that knee joint reset can help, as well as stretching your calves to make sure that you're not overpronating. Now, one other big question, probably the elephant in the room for most endurance athletes, especially runners: can I keep running? Can I keep exercising if I have IT band syndrome? And the answer to that is yes. In fact, you want to keep exercising if you have IT band syndrome, because again, it's a muscle endurance or a strength problem. And if you stop exercising, then you're going to get weak. And yes, the pain will go away. But when you get back to exercising, you're probably going to be in just the same situation or possibly worse because your muscles have gotten weak. So it comes down to managing how much you exercise or what type of exercise you do. If you're a runner and you can run 5 miles before your knee starts to hurt, then just run the amount you can. If you're a walker and you can walk a mile, but then your knee starts to hurt, just walk half a mile. And then you can make up whatever gap you need to fill your exercise requirements with cross training, whether that be biking, whether that be swimming, or some other form of exercise that you can do so that you can maintain your conditioning levels, along with doing the strengthening exercises for your glutes that I showed earlier, so that when you do get back to your activity of choice, that you haven't gotten deconditioned and weak, and that your IT band syndrome doesn't come back. So hopefully you did find that helpful. Now, if you are in the St. Louis area and you need some more help for IT band syndrome or some other type of knee pain, we'd be happy to help you here at More for Life. And no matter where you're watching this from, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.